Hello, everyone. Dr. Brooke Kolesiak here from Legacy Physical Therapy. Today, we are going to be talking about pelvic organ prolapse, which is something that can commonly happen to lots of women. And honestly, it's something that many women are surprised that can happen to them. So, pelvic support problems, when we're talking about them, think of it as our pelvis is the bowl that holds up our pelvic organs. So we have our bladder, our uterus, and our rectum and anus. And so those guys are all the organs that are lining up inside of our pelvic bowl. And so when we're talking about support issues or prolapse issues, some of these organs can start to fall or tip into the vaginal canal. And so there's different types of prolapse that can happen. And they're all named for which organ is potentially causing the problem. And that's so on the first one, if we're thinking about the bladder kind of tipping back into the vaginal canal, that is called a cystocele. So the bladder kind of drops down into the vagina. On the back side, we could have a rectocele where the rectum kind of tips forward into the vaginal canal. And this is happening because we have a weakening in the tissues, in the vaginal tissues, and they're getting kind of stretched out, and that support can lead to the tissues, the organs kind of tipping into the vaginal canal. It potentially can even drop so far that it's exposed on the outside of the body, and we can talk about the different kind of grades that there are for prolapse. So we talked about cystocele from the front, which is the bladder, rectocele from the back, which is the rectum tipping forward. We can also have a uterine prolapse where the uterus starts to drop down into the vaginal canal. And you can think of that kind of like a sock that's almost turning itself inside out, okay? Some women think that, if they've had a hysterectomy where, they have their uterus and or ovaries removed, that they're no longer at risk for prolapse to happen, but that's not the case. You can still have a cystocele or a rectocele and now what's considered a vaginal vault prolapse. So maybe you don't have the uterus up top, but you have the cuff, the top of the vaginal canal, that can start to turn inside out on itself. And so that can kind of come down. So even if you have had a hysterectomy, that actually puts you more at risk for potential for prolapse, as one of the risk factors is having gynecological surgeries, because that can kind of mess with some of the connective tissue and support structures that are there helping to hold up the pelvic organs. So we talked about the most common ones, cystocele, rectocele, uterine prolapse, and a vaginal vault prolapse. You can also have an enterocele, and this is where some of your small intestines kind of sneak down and can push into on the vaginal wall. This one's not as common, but it is something that can potentially happen. So what the heck causes pelvic organ prolapse or support problems? Many factors can lead into it. Giving birth is a big risk factor for it, and then especially if you've had a large baby. During childbirth, so the skin, the muscle, the connective tissue of the Virch canal is torn and or stretched incredibly large amounts. And so that stretching can heal over time, but sometimes it's not exactly the same. So think of a rubber band that gets stretched and released and stretched and released. So oftentimes that rubber band does come right back to its original shape and size, but sometimes it gets pulled so much that it can't, or it gets pulled so often that it can't go all the way back. It can go a good ways back, and it can improve where it's going, but it doesn't get all the way back to where it was. And so we can have some weakness or some increased laxity or give. This can especially be the case if there's a long pushing stage in labor, because all of that pushing and strain on it can stretch the tissues out more, and they potentially, that can happen where we don't get that recoil that happens as much. So that's where risk factors of prolapse can happen with having childbirth, and especially during vaginal deliveries that we're doing lots of pushing, and if it's a bigger baby. Next risk factor is after menopause. So the hormonal changes that happen change how the vaginal walls kind of structured because we lose some of the estrogen in there, and so that helps to keep the tissue toned, and that lower levels of estrogen can weaken the vaginal walls, and that can cause some of the organs to kind of shift or change positions a little bit, and that can put more pressure. This coupled with potentially loss of muscle tone of the pelvic floor muscles and other muscles around there can cause an issue. So that's another main cause that we see for pelvic organ prolapse. And there's some general conditions or things in our life that can kind of make a difference with it. So conditions like chronic coughing or chronic constipation or doing a lot of heavy lifting, or straining to pass stools. These are all situations that put a lot of extra pressure down through the pelvic floor, and can end up putting extra strain and stress on the tissues and potentially cause prolapse. Also, being overweight, that is extra load that the pelvic floor tissues have to carry, and that can potentially cause a problem. And that's so all of these can potentially lead to weakened pelvic support muscles and potentially prolapse. So we just talked about the different types of prolapse, and we talked about some of the common causes of it. Next, we're going to talk about how it's typically diagnosed. It's diagnosed by your healthcare provider, typically an OBGYN, maybe the one who diagnoses it, and it's typically done via visualization and or a vaginal exam. So typically your healthcare provider may ask you to be in a laying down position and ask you to kind of bear down or push like you're having a bowel movement, and we're going to see what kind of movement happens of the tissue down and out towards the vaginal opening. I'm going to, like I said, try and post a picture in the comments where it's showing a rectocele where the wall is tipping forward, and it almost looks like you get this bulge in the vaginal canal. So that's the most common symptom that a lot of people seem to notice with prolapse, is that they feel this bulge in the canal. Your healthcare provider may also check to see how your pelvic muscles are doing, to see if they're supporting things well or if they're too weak or working the way. And they also might do different bladder tests or nerve tests or muscle tests to see what type of treatment is best for you. So this is on the doctor side of things, if they're trying to figure out if we need to look more invasive, like potentially going down the route of surgery, or more conservative, like doing pelvic physical therapy, or potentially the use of pessaries for support in the area. So there can be many different types of treatment options that are there, and it basically depends on kind of how severe your symptoms are and what's going on, which treatment route may be best for you. And so what are some of the symptoms that people feel? So the symptoms of prolapse can be highly variable, and so it really depends a lot on the organ involved. So you might have urinary leakage, or you might actually have difficulty starting your stream and getting it going. It feels like your stream's more hesitant. You can have fecal incontinence issues where you have staining on the underwear or difficulty holding a bowel movement. You might have trouble passing a bowel movement, like it feels harder to get the bowel movement out. You might have aching or discomfort in the low back, the abdomen, the groin area. Sometimes women end up having more frequent bladder infections because they're having trouble emptying their bladder as well. You might have a feeling of heaviness or pressure or fullness in the pelvis. It might feel like something's falling out of the vagina. You might actually see a protrusion in the vagina or actually coming out of the vagina. Or you might feel like you need support to the organs, especially to have a bowel movement. Some women say that it's much easier to have a bowel movement if they kind of wrap their fingers in some toilet paper and they give a little bit of support right in front of the anus there, and then they can more easily have a bowel movement. And some women experience pain with sex when they're dealing with prolapse issues, so that can be another symptom. So any one of these can potentially be a symptom of prolapse, or a combination of. Like I said, it's really dependent on what organ is involved and what tissues are involved and what the woman might feel. As far as treatment options, typically a prolapsed organ, it can't repair itself, okay? So this is something that you want to do something about to prevent it from advancing further and or potentially help repair. Oftentimes, symptoms can be treated by changes in your diet, changes in how you sit to have bowel movements, potentially weight loss, changing how you lift or do different activities so that you're not putting as much stress and strain, as well as potentially doing strengthening for the pelvic floor and other supporting muscles around the area so that we've got as good as support structure as possible in the area. Sometimes prolapse may require more involved treatment. Some women do really well with what's called a pessary, which is a kind of a device that gets inserted into the vaginal canal to give some support to the vaginal tissue there. It potentially can help just take away some of that pressure feeling or improve on the bowel or bladder side of things. And this is something that you would get fitted for at your doctor's office. A lot of times the pessaries come in all different shapes and sizes, so it's really something that you got to find the one that fits best for you, and so that's something you'd work with your doctor with to figure out. And in the most serious side of things, surgery may be needed to help get the organs back in place, especially if the prolapse is large. We've got organs kind of tipping into the vaginal canal, and they're on, tipping all the way out of the canal, and that is something where surgery may be your best option that way. And there's several wonderful surgeons that specialize in working with pelvic organ prolapse patients. There's a whole specialty called urogynecologists, and those are the doctors I recommend that you seek out care from if you are potentially going down the route of needing a surgery, because this is what they specialize in full time. So what can you do if you're suspecting that you do have some type of a pelvic organ prolapse, or how can you prevent it from happening? So one, in general, maintaining that healthy lifestyle, being active, eating healthy, maintaining a good body weight, maintaining healthy bowels. All of that can play a big difference with it, because we don't want to be doing excessive stressing or straining through the area. You want to make sure that you have strong supportive pelvic floor muscles. So if you're having trouble figuring out where those are or what they're doing, that's a good time to partner with a pelvic physical therapist to make sure you're using them the way that they should be. Many women wrongfully think that they are using it the right way, and they're actually putting too much pressure through it. We already mentioned maintaining a healthy weight, avoiding lots of heavy lifting. Now, I want people to be able to lift and move and be active the way that they want to, but a lot of times people need some training in order to do that correctly. A lot of people, unfortunately, end up putting a lot of stress down through their pelvic floor with lifting because they're holding their breath or straining. So a cue I give people a lot of times is to exhale with exertion. We want to think about pulling in our belly and our pelvic floor and exhaling as we're going to do the hard part of the lift. And like I mentioned a little earlier, another thing that can be helpful is making sure that we treat constipation so that people aren't stressing and straining when they're having a bowel movement, because that's, again, another situation that puts a lot of pressure down through the pelvic floor. So all of those can be helpful to help prevent pelvic organ prolapse from happening. So there you have it. I was talking about what prolapse is, what are common causes, how it gets diagnosed, what are the symptoms, what are some different treatment options, and how you can prevent it. So hopefully that was a really good overview for people to kind of get some more information. And it looks like I have some questions here in the comments. So it says, let's see, I have a client with bad diastasis just diagnosed by me. She came in, bad back pain while lying down back. She's ignorant of diastasis, was into high intensity workouts. Her pain history is 6 months until it started working diastasis. How do we sure it's not a prolapse? Gotcha. So great question with it. And oftentimes, so diastasis, for those of you who don't know, is a separation of the abdominal muscles. And when we have those abdominal muscles separated, that can really change how people are able to create support and pressure or regulate pressure in the abdominal cavity, which might mean that they're putting more pressure down through their pelvic organs and through their pelvic floor. And we want to make sure that they are using their deep abdominal muscles well as their pelvic floor muscles. And oftentimes when people are doing really high intensity workouts, if their core muscles aren't working well, they're going to use a lot of pressure to stabilize and move, and that can put more pressure down through the pelvic floor. So, how do you know if they don't have a prolapse? It's really hard for you to potentially know just by asking questions, because some of the symptoms that we talked about can be caused by other things, or it can just be symptoms that stand alone. It may be a good idea that you recommend that she does get checked out by her OBGYN, just and see if something's going on, especially because she has frequent urinary infections, or if, definitely getting, if she hasn't already been checked out by a pelvic physical therapist, that would be helpful to help her make sure that everything's working well down below. So, great question. Thanks for asking it. So hopefully you guys found this helpful, and we'll keep working through all of the suggestions that you gave us, and that when Jamie and I posted out earlier this week of things you want to hear about. So keep telling us what you want to learn more about, and we will keep sharing. So you guys have a great rest of your day, and check out the comments, because I'm going to try and put the graphics in there that I wanted to share. So sorry that I wasn't able to share my screen. So I will talk with you guys later. Bye.